Right, Joe. I was more curious, what got you started in wanting to be a PA and how did you pick your specialty?
So I've been in clinical practice for 22 years. Graduated back in September of 1995. Back then I had already been in the workforce for a number of years and had to make some changes. Was married, had two kids, and so I knew I wanted to do something in medicine. I just didn't know what at the time, and then I found out about the physician assistant programs. There was only 50 of them in the country at the time.
Oh, wow.
So I started pursuing that, and God just opened up the doors for me to get in.
That's awesome.
Yep.
When you were in it, did you do multiple specialties before you found yours, or did you kind of know right away what you wanted to do?
So once you go through all the didactic portion the first year.
Hmm.
Back then, the PA programs were only 2 years long,
Okay.
and they just crammed a lot into it as opposed to almost everybody does a master's now and makes it 3 years. Um, so first year is all didactics, third year is all your rotation. Excuse me. First year is all didactics, second year is all rotations. So you spent time doing family practice, internal medicine, endocrinology, OBGYN, pediatrics, emergency medicine, and you could do specialties if you wanted to, like in orthopedics or surgery. So those types of things. So you had a pretty well-rounded exposure to the medical field to get a better idea of what field you wanted to go into.
Right. That's awesome. I think they're still doing, well, CB is doing the 2 year program, and then, so it's just the 1 year, and then second year is the clinical rotations. So I
Gotcha.
think they're trying to do that accelerated as well.
Yeah, they didn't really change much at the school that I went to, which was St. Francis University in Pennsylvania. When
Okay.
they switched over to a master's, all they did was add, I think, 4 units for the thesis and spread it out for 3 years.
Oh,
So
okay.
it's like, well, wait a second, that's not fair.
Right?
So anyway, yeah, that was a little annoying.
Yeah, definitely. And then or a couple other questions. What qualities do you look for when you're hiring someone in the PA field?
Um, it's got to be a combination. I can't say it's just one thing. They got to have depending. Like right now, I do internal medicine,
Hmm.
and that's actually what I started off in back in '95, and then eventually transitioned through had a few changes, and ended up in emergency medicine for about 13 years, and then back in internal medicine.
Oh,
So
okay.
the reason I say that is you have to kind of find out what their knowledge base is for whatever field you're going to be in, and then you have to have somebody that wants to be a team player.
Right.
They can't be wanting to do everything on their own. As a PA, it's supposed to be a relationship between you and the physician. You're not supposed to be an independent practitioner,
Right.
and so you have to have somebody who, especially in the beginning, is willing to learn because you're not going to know it all in your first job going into it. You're just not. Even if you do a residency program, because there's a lot of residency programs for PAs
Hmm.
now, you're still not going to know it all going into it. So you got to have somebody who's willing to learn and someone who has a good personality that they can interact with patients
Right.
because that's a good portion of our job is to be able to interact with the patients. You need to gain their confidence by treating them appropriately. Making them better.
Right.
Um, but it's just one of those things that you got to be well rounded.
Okay. Would you say that you notice a big difference with how much time you get to spend with patients compared to the physician that may be at the same workplace as you or at different clinics even?
In the beginning, that's true. For as long as I've been in practice, no. So in the beginning, yeah, you're going to be spending more time with patients. You're going to be able to spend, the 20, 30 minutes with the patient.
Hmm.
And that'll probably happen for the first, maybe, well, I'm not going to say a year, maybe 3 to 6 months. And
Okay.
then they're going to start picking the pace up, as you get more comfortable.
Right.
Because Unfortunately, I got into medicine for all the altruistic reasons.
Okay.
I wanted to help people and all, but unfortunately, it is just a business,
Yes.
and that was a slap in the face to me.
Okay.
So you have to be able to have enough volume that you keep the lights on, that you pay the staff, that so and if you're not seeing enough patients, you don't pay those bills.
Right.
I still do it for the altruistic reasons, but you just got to pick up the pace.
Okay. Speaking of being new and when you first start, how long did it take you to feel like you knew what you were doing after you graduated PA school?
Boy, I've been practicing for 22 years, and I'm still learning at this point.
Okay.
And I put it in those terms because I think you should learn something new every day, pretty much. And I'm at a point in my career where I have physicians coming and asking my opinion
awesome.
on different cases. Physicians I respect and who are very good physicians, but they will come and ask, Joe, what would you do? If it's something that they're not as familiar with, they'll come and ask me, how would you treat this? What are you going to do with this?
That's awesome. You can work so well with them.
Yeah, and I've gained their trust over the years.
Right.
They've seen how well I perform, how well patients like me, and patients get better. It's like, okay, this guy knows what he's doing.
Yeah, that's awesome. What would you say is the most rewarding aspect of being a PA?
It is a privilege to be able to take care of patients. And many times I've seen those practitioners who lose sight of that, and you can never lose sight of that. It is a privilege for someone who is coming to you and willing to put their life literally in your hands. And they're counting on you to make the right decisions and get them better.
That's great.
And in the beginning, that was an overwhelming thought for me. I can't tell you how many times the first couple of years in practice, I'd be waking up in the middle of the night. Oh, did I order this test? Did I forget to do that? Oh, wait a minute. That was just going on and on.
That's awesome.
For the first couple of years. But then once you realize that you just need to rely on your training, if you've been trained well, hopefully so, rely on your training and your clinical gestalt, and treat them appropriately, and it all works out.
Would you say it's hard to separate work from home when you do have patients like that? Do you get connected with them?
In the beginning it was, not anymore.
Okay.
We were trained that you need to have empathy and not sympathy. Mm-hmm. And sympathy is pouring your heart and soul into them. Empathy is professional caring.
Okay.
And while that may sound like political doublespeak, it really isn't. No, because you need to be able to have that professional caring and put your all into it, but you can't put your heart and soul into it, because if you do that, then and the person as they get older, everybody's going to pass,
right? And
especially in internal medicine, your patients, there's a constant turnover of patients because you have patients that are getting older and just dying of natural causes. You just can't put your heart and soul into it, because then you're no good to the next patient.
Right, that's understandable. Well, Joe, thank you for letting me ask you these questions. I really appreciate you talking with me. Would it be okay if I had you maybe do a mock interview and ask me a couple questions?
Sure.
Okay.
Now, when you say a mock interview as a PA or just as a student or someone who's trying to get into a program?
It would be as a PA. So if I were coming to you to be hired as a PA, obviously I'm not there yet or close, but I do have a list here, the questions that my assignment would like me to ask or have you ask me.
Okay.
The first one is, if I was looking to be hired from you, what are 1 to 2 questions that you would ask me in my interview?
Okay. And this is, you've already graduated school?
Yes.
Theoretically. Okay. I don't want to be too hard on you.
That's okay.
Because I have interviewed a lot of PAs over the years for especially when I was in the ER. I was the admin in the ER, so I did a lot of the hiring and all that kind of stuff.
Oh, that's awesome.
So, okay. So, what I'll do it last if we were in the ER.
Okay.
So, what brings you to this hospital? Why did you? What makes you want to come here and work at this hospital?
Well, I've done a lot of research on the hospital. I feel like it's a good place to be. I like the energy and the fast paced environment. I feel like there's a lot to learn from it and a lot of room to grow.
Okay, for sure.
Again, I don't have much experience yet because I'm not through school, so not
Right.
sure, but
No, that's why I'm choosing my words carefully, trying not to be mean. Um, okay. And as far as are you looking to work full time, part time? Are you willing to take criticism?
yeah, I'm willing to work full time, overtime, long hours. I know that's all part of medical, part of the job. And I think criticism is great as long as you can grow from it and learn from it and not take it personally.
That's exactly right. Yeah, so don't take it personal. Um, yeah, don't take it personal.
Okay.
Because the bottom line is we're here for the patients, and if you can't take constructive criticism because the patient comes first,
Right.
then you're in the wrong field.
Okay. Great. Um, the only thing, the only thing I'd like to ask you before we go is, would you be kind enough to provide me with some tips and words of wisdom on becoming a PA and getting through school?
Sure. So part of it is what I had just said in terms of you've got to be able to take criticism. If you can't take criticism, you're not going to do well in this.
Okay.
They are going to, at least when I went through it, it was kind of the way the residents would go through things that they would push you to your limits.
Mm-hmm.
And they would try to break you at times. Like when I did my OBGYN rotation, I would be on for 36 hours and then off for that night and then back in the clinic the next day, work 2 day shifts and then a 36-hour shift.
Oh my gosh.
And part of that is that they push you so you're so fatigued and so worn out, and you still have to make the right decisions when it comes to patients. Because if you can't make the right decisions, you can potentially kill someone.
Right.
So I don't think they do that as much now, as far as pushing you to those limits, exhaustion and everything.
Mm-hmm.
Things have changed, both in the residency programs for physicians and I believe for the PAs too. But so be all ears when you're doing the rotations. Take lots of notes. If you're in a hospital setting, make friends of the nurses.
Okay.
Okay, because the nurses will either break you or make you.
Okay.
And I mean that quite seriously. I saw nurses who had residents that they didn't like. That the resident was so cocky, so full of self. I'll put it that way. The nurses would set them up for failure.
Oh wow.
Just to see them go down.
Okay.
So first thing I learned when I was in hospital settings, make friends with the nurses. Doesn't mean that you kiss up to them or don't be be yourself, be real, but definitely treat them with a lot of respect and kindness, and they will do the same to you.
Okay.
And they will make your rotation there so much better.
Okay. That is great tips. Joe, thank you so much for doing this with me. I really appreciate it.